So the future of FM is going to be digital. In future, facility managers will work alongside intelligent personal assistants, or IPAs for short. In fact, we have them actually on most of these smartphones. The like of Google Assistant, Siri, or Cortana already running on most smartphones, smartwatches, or tablets. And they're becoming more and more, or they can do more and more over the time period. So what is an IPA? So an IPA is understood as a digital virtual artificial entity that has one or more electronic user interfaces that allows it to use voice, vision and contextual information in order to streamline and automate processes and to assist the user in his daily activities. Now, the healthcare industry is seeing major technological developments, especially in the areas of cloud computing, data exchange platforms, wearable technology, data analytics, and artificial intelligence. Especially AI is seen as a huge opportunity for the healthcare industry. Now, drawing on intelligent sensor networks and big data analytics, new socio-technical systems are being developed that allow to create highly interactive hospital environments. These future smart hospitals can automate can exchange entire information flows across different healthcare organizations and automate various services and operations. So at the same time, we're also seeing a need for innovation and ICT solutions in the healthcare industry. There's growing pressure for healthcare systems. If we look at, for example, the Swiss healthcare system, the yearly costs are 70 billion Swiss francs. That is 11% of our national GDP. And these costs, they rise each year by 4%. Now, if you look at hospitals, these amount to about 40% of the total healthcare costs. And interestingly, within those 40% of the healthcare costs, one third of these costs are related to FM relevant services. So obviously FM plays an important role in introducing or with bringing down these costs. Now, FM organizations see themselves obviously also confronted with fewer resources and increased financial pressure. So there is clearly a need to bring in new innovative technologies such as IPAs. In fact, IPAs are already used in certain hospitals to collect information from data banks, medical systems, or network devices. They can actively monitor patients and detect various activities within the building. Doctors now can input and access medical reports using voice input. And patients use IPAs as medical assistants. And assistant robots are now welcoming patients at hospitals. So what does this mean? We have to look at IPAs in a broader context with other digital systems and devices. Together they form these smart hospital environments. Importantly, IPAs interact as allow the natural interaction with these environments. So we looked at future scenarios we looked at future FM scenarios in which IPAs can be used alongside patients and visitors. These could be seen in information management and registration, signage and navigation, transport and logistics, safety and security, or catering. So now that we have a bit of an understanding of the broader context and the technological developments, we asked the question, what are the key prerequisites on a strategic level in order to introduce and integrate an IPA system to into the processes between patients, visitors, and non-medical support services in Swiss hospitals. So in order to answer the research question, we used a multi-method design. We conducted a 2-round qualitative Delphi study with 7 FM experts that had an overall understanding of processes and digital healthcare. In the first round, we confronted the experts with open questions that they answered. We then summarized all these information, all these answers, and confronted them with all answers from all the experts. In the second round, they were then able to correct, complement, or rewrite their answers. To validate this Delphi study, we also conducted 2 expert interviews with AI experts from major technology companies. To develop the data collection tools and to confront the experts with state-of-the-art knowledge on this IPA, IPA technology, we studied 61 blog articles over a period of 6 months. All data that we collected, we analyzed using data matrices. So the findings show us that the following main 4 topics are central to the integration of IPA systems in healthcare. These are governance, culture, processes, and technology. So I'd like to now highlight the main findings of these 4 central topics. So one is governance. Here, first and foremost, it's about delineating the framework requirements, such as the scope of the project and the financial aspects. These include investment security, economic efficiency, and the necessary financial resources. What is advisable is to start with a small use case scenario before launching full-fledged system. A central concern here is obviously data governance. The question here is, who has access to the data and how secure is it? Number 2 is culture. And culture is key when introducing such technology like IPAs. And it all boils down to change management. We need to address the fears of the employees at an early stage. Staff can see their job roles threatened by this new technology. What is also important is to find the right fit of the IPA system with the overall hospital strategy. This reflects also the concerns with patient and visitor acceptance of such technology. Number 3 is processes. This is about designing the processes, how to shape the interaction along the different process steps of an IPA and the different users, such as hospital staff, FM personnel, visitors, and patients. Lastly is technology. Here are 2 main infrastructural premises. These are on the one hand, high-speed Wi-Fi connection across the entire building in order to establish such a system, and this Wi-Fi needs to be secured, as it is likely that data or confidential data is handled over this network. So all things considered, this is not a pure technological debate. In fact, it's a debate about culture, it's a debate about strategy, and it's a debate about management. And we find that culture is the critical factor preventing the proliferation of such technology. We need to understand the attitudes of the different stakeholders. And FM can play a critical role in this, defining the processes, interfaces, and aligning the IPA system with the overall hospital strategy. The FM role will be as a facilitator between these different stakeholders. So I highlighted these 4 important key prerequisites on a strategic level: governance, culture, processes, and technology. Obviously, there's a need for further research. We need to address also the topics of ethical concerns, such as accessibility, usability, control, privacy, and trust. Only if FM can restructure their processes, adapt their infrastructure, and embrace new technology can they face their challenges of fewer resources and increased financial pressure. Thank you very much.